Dr. Rachel, welcome.
Hello, thank you for having me.
Welcome to India virtually.
Thank you.
So my co-host Ira. Yeah, Ira, over to you.
Yeah, Dr. Rachel Brown, welcome to the second Metabolic Health Conference from India. Namaste and good evening to all our viewers and watchers who are listening to or tuned into our sessions. I'll give a brief introduction of Dr. Rachel Brown. She's a consultant psychiatrist in the UK who specializes in metabolic health. She graduated from Edinburgh University in 2003 and has worked in the field of psychiatry since 2004. She's a nutrition network advisor and certified functional medicine practitioner. She also holds a master's degree in medical law and ethics and is involved in ongoing research into ketogenic diets and mental disorder. Dr. Rachel is an advocate for therapeutic carbohydrate restriction and dietary modification to address underlying metabolic dysfunction and gut dysbiosis as underlying causes of mental disorder, as well as other lifestyle measures for optimizing health. This is a brief introduction of Dr. Rachel Brown. Welcome to this session, Dr. Brown.
Thank you. It's good to be here.
So I'll start with a little provocative question. You were the conventional psychiatrist prescribing medication. So is this system adequate or is it redundant? How would you how would you say, going by the past experience plus the emerging science which is happening, very exciting space. So what is your comment on this?
Yes, I had noticed it was a bit of a controversial question to begin. So I continue to practice as a traditional psychiatrist, as well as having started a metabolic psychiatry clinic within the National Health Service in the UK, and also working privately with clients more along a functional medicine paradigm. So I often feel pulled in many directions. And it's safe to say I do get frustrated with the standard treatment approach for people who experience mental health symptoms. So my own personal view is that the current approach is not adequate and that a lot could be done to improve the treatments that people are offered who come into contact with mental health services. And it's just unfortunate that many of the medications that people get prescribed can have metabolic side effects as a consequence of the treatment. I think what is lacking in standard care is just any sort of consideration around dietary approaches, nutritional approaches, and also other lifestyle advice that can be fairly easy for people to implement, but it just doesn't tend to get focused on, and certainly wasn't in my training and throughout my years working as a consultant psychiatrist within the NHS.
So I think just expanding on Ira, just expanding on what Dr. Rachel said. So we now understand that there is some metabolic angle involved. So patients come, you give medication, and they worsen the metabolic condition. So it's probably a vicious cycle of what we are undergoing, probably.
Yes, I mean, I think there are, mental health can always be complex, and there can be many differing factors for different people. But there's a lot of research out there suggesting common mechanisms at play underlying all the different diagnoses that we tend to give people. So it's safe to say as time has gone on, I've become more and more frustrated at the diagnostic classification system, never mind anything else. And certainly metabolic health is a huge factor for many people. Dietary choices come into that as well. I think we'll come on to it later, just about vegetarian diets versus sort of meat inclusion diets. But a lot of patients I see and encounter in my NHS practice do tend to be vegan or vegetarian. There may be some recall bias on my behalf because I tend to ask people about this, and it just seems to me there are a lot of people who are vegan and vegetarian these days, and I don't think personally that that's optimal for mental health. But there's some really interesting research just looking at oxidative stress and the role that can play in the brain, And we know that the brain and the central nervous system are particularly vulnerable to oxidative stress. And when I talk about that, we're just really talking about an imbalance between the endogenous antioxidants, the antioxidants we have already in our body, and then free radicals or reactive oxygen species that get produced as part of everyday metabolism. And unfortunately, some of the older style medications can increase oxidative stress in the body. And then we know some of the more modern, particularly antipsychotic drugs, do increase the risk of insulin resistance and type 2 diabetes. And the research coming out now, and the research that also seems to be clear from other clinicians across the world who have been using very low carbohydrate diets as an intervention for mental health, shows that having high levels of insulin does tend to be detrimental, and particularly insulin resistance, which would occur at a much later stage. So you do have to question the utility of some of the standard medications that we use, because I do worry from an ethical point of view that we might potentially be worsening people's prognosis or outlook longer term if we're also adding in medications that can be detrimental to an existing terrain in terms of the body that might not be optimal.
So I think you've explained a bit of what I was already going to ask you. So I'll probably combine it all and ask you, Doctor, tell us why diet is not co-factored when we are looking at mental health, and what is the connection between the two? And then subsequently, what is the correlation between metabolic health and or insulin resistance and mental health? What is the correlation of the food with the mental health?
Okay, so the why is diet not considered becomes a bit of a political question in a way, because I think that comes back to our mainstream medical education system, and who that was founded by, and also potentially some of the pharmaceutical influences that there are in relation to university education. But certainly from an allopathic medicine point of view, we were never really, I certainly didn't receive any training in medical school about nutrition, and there's never been any emphasis on that throughout my psychiatric training. We're not even told to really ask in detail what people are eating. It's just more, is your appetite reduced, or has your appetite changed in any way? So it's a very cursory inquiry that tends to happen. I think this is where the tension occurs between allopathic medicine and functional medicine, because functional medicine doctors tend to focus more on the root cause of illness and have a completely different way of formulating or looking at a patient's set of difficulties. Whereas allopathic medicine, in my experience, is driven by making a diagnosis to then implement a pharmaceutical treatment plan largely. There are, of course, other treatments available within psychiatry, such as psychology and other disciplines that might help in a positive way in terms of a patient's treatment plan, be that occupational therapy or physiotherapy and art therapy, other allied professions. But certainly from a medical point of view, there just has never been any emphasis on really looking at a patient's lifestyle particularly. Sorry, just remind me what the other questions were.
Yeah, so what is the connection between insulin resistance and mental health? Because diet is not always co-factored when you're looking at mental health. But definitely you're saying it is the opposite is true. So explain the connection between insulin resistance and mental health.
Well, we know that populations with insulin resistance, such as people with type 2 diabetes, which we would consider to be end-stage insulin resistance, we know that people with type 2 diabetes are more likely to experience depression. But also, if you have a diagnosis of depression, you're then more likely to develop type 2 diabetes subsequently. It gets somewhat complicated because I've just recently been looking at the research in relation to antidepressants, and there is a strong suggestion that some antidepressants might also increase the risk of type 2 diabetes. But other patient populations, so if we go by diagnosis, bipolar disorder, we know from the research literature that particularly if you have rapid cycling bipolar disorder. So that's someone who would experience 3 or 4 episodes, significant mood episodes in 1 year. And typically it tends to respond less well to standard medication regimes. We know that you're more likely to have insulin resistance than not. So it's over 50% of people with rapid cycling bipolar disorder have insulin resistance on testing. And there's some really nice research coming out of Canada. I think Dr. Cynthia Culkin and her team have published a number of studies indicating that particularly in people who do not respond to standard treatment regimes such as mood stabilizers like lithium or antipsychotic medications, that if they're able to implement a metabolic intervention such as prescribing metformin being one example, we know that the cohorts within that study who were shown to reverse their insulin resistance then also restored their response to standard treatment protocols. So these were people who had become treatment resistant over a number of years. So there's a lot more research going on, but that's just one particular favorite example of my own.
Fine. Currently, is there any dietary protocol which is given? I mean, do psychiatrists ever discuss about diet? Do they ask? Is there anything which is told it could be as plain as avoid sugar? It could be just anything. But is dietary thing ever discussed either in UK or globally when it comes to psychiatry?
Certainly my experience in the UK is that there might be some cursory discussion around make sure you're eating fruits and vegetables, but it tends to focus on the food pyramid or just the standard dietary guidelines that were never really evidence-based, in my opinion. So I feel very alone, certainly locally where I work, because I do definitely speak to people about diet, but as a standard, no, I would say from what I've seen, when people are very unwell and struggling to eat, often they're encouraged just to eat whatever they can. And in my experience, that tends to not be the healthiest choices. So inevitably it's cereal or toast or very carbohydrate-based diets. And my experience as well is I tend to go out and see people in their homes as part of my NHS work, and often the evidence is there to be seen. So it's very often that I see people in their homes and there's packets of crisps lying around or bags of sweets, or people, if you ask, people tend to be eating toast or porridge and just very carbohydrate heavy meals.
So I just wanted to expand on this. Of course, the standard protocol always remains eat more fruit and vegetable. This is across the spectrum. You take any disease, the first thing people will say is eat more fruit, vegetables. And I have seen it. Right from the healthy diet to obesity to diabetes to psychiatry, anything. I think this becomes a little standard thing and globally. Now, what is the correlation between the modern processed food and mental disease? Do you think there is any correlation?
Oh, absolutely. Because I mean, my advice would always be to somebody, if they could make one change, even if they don't want to go very low carbohydrate, it would be to focus on having a whole food, a fresh food diet, and to eradicate the processed foods, because the processed foods are inevitably laden with inflammatory seed oils, industrially processed inflammatory seed oils. I think Dr. Georgia Eade might be coming on after me, but I saw a lecture by her and she very eloquently spoke about the role that inflammatory seed oils containing linoleic acid tend to play in the brain in terms of increasing oxidative stress and inflammation, the very thing that we are trying to prevent. So yeah, absolutely, they're detrimental.
Ira.
So, extending Shashi's question, I want to ask you what should be then the dietary recommendation for people struggling with such conditions, according to you?
So I think there can be some individual variation in this, but I would always tend towards advising somebody to try to think about adopting a lower carbohydrate diet. It's not necessarily the case that absolutely everybody needs to follow a ketogenic diet, in my opinion. However, I think just from a general health perspective, if people are able to bring down their insulin levels over time, then that is going to be a positive effect just more generally, as well as in relation to their mental health. So I suppose you could consider a lower carbohydrate diet to be under 100 grams per day. If you're talking ketogenic, you're really talking about 50 grams or less of carbohydrates per day. And for some people, they may need to be particularly strict about the carbohydrate content and get down to 20 grams per day. But I would always caution people, particularly if they've had a major psychiatric illness, to get support when doing this and not to just go off and do it on their own, because there can be implications in relation to prescribed medications and altering a ketogenic diet, for example, altering levels of mood stabilizers being one example. And then also when you go through a keto transition period, so typically the first 2 or 3 weeks of changing over to a ketogenic diet, you can experience potential instability in terms of mental health symptoms.
I'm curious to know, do you measure insulin levels in your patients? Have you seen insulin dysregulation? This is question one. Question two is it possible that someone seems to have a normal insulin level, still have a mental health disorder?
I have seen high insulin levels and resultant high HOMA-IR scores, which would be a calculation of your insulin resistance. However, I was only allowed to test a handful of patients within the NHS before I had my knuckles wrapped and was told to stop doing that. And it's a funny story because the phlebotomist I was working with had never checked a fasting insulin level before. So it was quite a process for us to work out what lab form it went on and how to get the labs to do it. But then management in my hospital asked me to stop doing it because it's not part of the standard care, even in the diabetic clinics. And in my view, it's just so wrong, because we know that people can be pre-diabetic probably for a decade before they develop actual frank type 2 diabetes. And there's so many more people who could be picked up earlier, at an earlier stage, and be given appropriate advice, who could then prevent themselves from becoming vastly, frankly, pre-diabetic and ultimately developing type 2 diabetes. In terms of the small number that I did manage to check, there were some horrific scores in terms of HOMA-IR and measure of insulin resistance. There was also a lady with a bipolar diagnosis who had a borderline insulin resistance score, I would say. However, she went on to adopt a ketogenic diet and responded very quickly and very well to it. So yeah, that's been my experience so far.
Yeah, Ira.
Yeah, so you just talked about mood stabilizers, Dr. Rachel. So lithium being our standard mood stabilizers, if for bipolar disorders, does insulin resistance in any way interfere by the outcomes that you try to achieve through this?
Yes. So again, going back to Dr. Calkin's study, they had people on lithium and quite a number of other different prescriptions who did manage to restore response to lithium ultimately. And what tends to stick in my mind is that I think the cohort of patients she was working with were people who historically once responded to lithium and had good control of their symptoms, but then over time developed either more frequent episodes of mood disorders or just persistent mood symptoms that then did subsequently resolve again once the insulin resistance was addressed. I've certainly had somebody very recently in the service who has a schizoaffective diagnosis, so there's definitely a mood component, who is on lithium, 2 different antipsychotics, a benzodiazepine, I think a couple of other medications, and there's somebody who's had very frequent relapses in terms of their psychotic and mood symptoms, and also frequent admissions to hospital. And just very recently, they weren't willing to change their diet. However, they were willing to try adding metformin into their medication regime. And actually, that's had a very beneficial effect and improvement in their mood symptoms just in the last few weeks. So that's really encouraging to see.
Is mental health disorder somewhere related to genetics? Is it possible that some are genetically prone to it? Is it genetics? Can we avoid this? How is it?
Oh, yeah, there's definitely a genetic component for some people in that you see family histories of major mental disorder, and you can see illnesses running in families. And I was always trained to inquire about family history of different mental disorders. However, I'm very much a proponent of telling people it's about epigenetics, not genetics. So our lifestyle choices, we do have the ability to influence our gene expression and our risk of developing illnesses. And my own view is that genetics really accounts for a very small proportion of people. And even when you do have a positive family history, there's still so much that can be done in terms of looking after your circadian rhythms, looking after your light environment, managing your stress, but also minimizing metabolic dysfunction using diet and lifestyle.
Dr. Brown, you are a carnivore yourself, and I've watched a lot of your videos where you've talked about it. Please tell us how ideal is a meat-based or a carnivore diet for mental health, and can a vegetarian achieve the same outcomes through that kind of a diet?
So my personal opinion would be that it is on average better for people to include some sort of meat in their diet as opposed to be vegetarian. There are a number of different reasons for that in terms of nutritional content of different foods, but also even just DHA, which is one of the omega-3 fatty acids found in fatty fish. That's incredibly important for the brain, and the brain is incredibly rich in terms of its DHA content. And that just can't really be replicated in a vegetarian diet without an awful lot of supplementation. And then you run into difficulties with supplements in terms of oils being rancid or not quite the correct form of DHA that you would get in a natural food. I do know of people who have improved very significant symptoms of mental illness using a carnivore diet who didn't necessarily improve sufficiently on a ketogenic diet. And so I think there is a spectrum, because there are some people who can improve using a ketogenic diet. But I also know of others who had to go one step further and exclude plant matter from their diet and focus primarily on meat. I've had one or two people, not very many, but particularly when it comes to brain fog, I've definitely seen some people say that they've experienced improvements when they've gone more carnivore as opposed to keto, which is really interesting to me.
Yeah.
Do you see, in spite of someone adopting either a low carb or the ketogenic or even going carnivore, still they are intractable, not able to get out of, let us, for example, have you seen any bipolar case which is not responding to all this? So what could be the other possible reason? Is it that they require additional drugs, or it could be some other etiology which we are not identified in your experience?
Yes, I have seen someone who initially responded very well to keto and then subsequently had real difficulties. And that person had quite a number of different life stressors going on, which I think was a factor. However, there can be other difficulties as well. So that person ended up being prescribed quetiapine, which is one of the more modern antipsychotic medications, and subsequently experienced very significant food cravings. And they were unable to maintain their ketogenic diet, or ended up having to get up at night and snack overnight on foods that weren't ketogenic. However, I do know that they had experienced a relapse of symptoms prior to medications being adjusted. So it's become quite complex. From a functional medicine point of view, I would certainly view that other toxicities and toxic burdens in the body can be an issue, as can gut dysbiosis or inflammatory bowel conditions. So there's a huge connection between the gut and the brain, and not just along the vagus nerve, but there is chemical signaling that goes back and forth, and immune molecule signaling. that goes between the gut and the brain. And so certainly in my functional medicine practice, that is something that we can look into in further detail. But in terms of standard NHS care, that isn't something that's on offer there. So you're limited more to altering diet and giving people advice about their light regimes. But I'm certainly an optimist that there's a lot more that can be looked into if people are really having difficulty and not responding fully to, despite having implemented a ketogenic diet, for example.
Yeah, I think so. Possible you will say that you do say that gut dispersers could be one. Which may
It
not
could be, yeah, I think, oh gosh, it gets really interesting. So deuterium is a topic that I'm really fascinated by, and deuterium being a heavy hydrogen and its impact on mitochondrial function. And the research, I think, is just coming out in relation to this. But I think for some people, it might well take them a longer period of time to deplete deuterium that is detrimental in terms of mitochondrial function. So sometimes it can be a case of time, and ketogenic and carnivore diets are naturally deuterium depleting diets because deuterium tends to be stored in the sugar or the starchy part of plants and would be a bit higher in grain-fed meat, for example. But there are other things you can do to deplete it, such as sauna, sweating, being out in the sunlight, using cold thermogenesis. There are a lot of different other interventions that can be helpful from that perspective.
It's very, very interesting. I think I'll remember this deuterium depletion possibilities are there. I wanted to ask you one more, because do you see a very strong connection between food addiction and mental illness? There's possibility that there's a strong food addiction with the person, or even it runs with the family.
Okay. To be honest, within the NHS, I probably haven't inquired specifically about family members. However, I would say yes. I see that very commonly, and I certainly encounter quite a number of different people who just aren't willing to even consider changing their diet. And I suspect a lot of the time that does come down to food addiction reasons. It's a shame that food addiction isn't recognized properly just within standard care model, because I think it's an absolutely massive issue, certainly for some people.
Yeah. What about those other therapies? Like, let us say the person has to go and do little more activity, little more exercise. Other than the medication and diet part, let us take out the other one. Do you think activity like exercise, say resistance exercise or yoga, or just going out and standing out in the sunlight, other thing like grounding, these
Yes.
things are also said to have some positive effect. What do you think about these components?
Oh yeah, absolutely. So I think those are just as important as diet. So particularly getting out for morning sunlight at sunrise and in the hour after sunrise, and just being out as regularly as possible throughout the day, because otherwise our body doesn't know what time of day it is, and our circadian rhythms are absolutely vital when it comes to mental health across all the different disorders. And often mitochondrial dysfunction appears to start with circadian disruption, and then the metabolic issues seem to come later. I'm an absolutely massive fan of grounding. So people getting out barefoot, being in nature, picking up the electrons that they can from the negatively charged Earth's surface that can help to regulate our nervous system response. So to put us more into a parasympathetic rest and relaxation system state, as opposed to the sympathetic sort of overactivated excitatory states that you often see nervous system dysregulation and elevated cortisol levels, dysregulated cortisol in patient populations who have experienced mental health symptoms. And yeah, going along with the deuterium is building up the exclusion zone water, or the fourth phase of water that our mitochondria produce, which again is just absolutely vital for building up our terrain in terms of it being resistant to environmental toxins.
See, in India, we are still in the infancy stage as far as the dietary part is concerned, whether it's a ketogenic or carnivore. So, people here feel that ketogenic means your kidney is gone. You're going to get heart attack. And when it is carnivore, then there is a very big, terrible fear, and then people will think you are a quack or charlatan. So,
Mhm.
how safe are ketogenic diet is one. And Ira is very eager to ask about how safe is carnivore because she herself is a carnivore diet who has reversed a lot of her autoimmune conditions. So, what is your how long have you been advocating ketogenic and carnivore? How long did you find any adverse effect with these two?
No adverse effects so far. So I'm coming up for being 5 years predominantly carnivore, and prior to that, I always forget, but I was ketogenic properly probably 2-3 years prior to that, and then low carb for quite a number of years before that. So it's been a bit of a sliding scale journey for me. I think it's really interesting. So in many ways, I always like to view health from an ancestral perspective, and I often think that's helpful when people try to argue with you, that, or they think that eating processed foods, or even dairy, sometimes it can be problematic for some people. When you take the bigger view and the longer term perspective, it is primarily animal foods that have formed the human diet over the course of evolution. I think, though, to be fair, there aren't that many carnivores, and there's not a lot of research at the moment into that. So I think it'll be really interesting to see what happens in the coming years in terms of if anybody is able to publish research to convince others about the safety of that type of diet. But when you start to look at nutrient density in terms of foods, then it is animal foods that win out, despite what we're told about antioxidants and blueberries or whatever other food it may be. So yeah, I haven't had any detrimental effects. If anything, I've just had improvements in my own health, and my N of 1 has been a positive journey, certainly in terms of a ketogenic diet and carnivore. And actually, part of my journey has included food addiction, and particularly sugar addiction, which I didn't really fully appreciate until I became carnivore. So being keto really helped with that, but carnivore completely shifted the dial for me, in terms of just taking away any cravings that I would have had for those sorts of foods.
That's very interesting. So that was one question I wanted to ask, whether you had a personal journey with food addiction. Yeah, Ira, you wanted to ask something.
This is very interesting because I had a meeting with a neurosurgeon a few months back. And what you're saying, Dr. Brown, is completely contradictory to what doctors are actually doing with people. And in one of my interactions, they said that, we actually advise giving sugar, a spoonful of sugar, if they have, these conditions, because that somehow, calms them down, especially people with migraine, stuff like that. And here I am, you are telling us that this is the absolute opposite of what is being done. So my question to you is, what do you think should change in the practice of modern psychiatry today as it is being practiced? And what are the paradigms that the doctors and psychiatrists should take into account besides allopathic medicine, which, as you said, is largely non-responsive?
Yeah, so that's fascinating to me that somebody would be advised to eat sugar for migraine, considering there's clear research there in terms of the potential benefits of a ketogenic diet for migraines, but more importantly, the fact that ketogenic diets have been a treatment paradigm for treatment-resistant epilepsy for at least the past 100 years, with extremely good results, when other medications prescribed within neurology have not brought about symptom control in epilepsy. I know Georgia is going to be on after me, and one thing that she always says is we only have one brain, and it's the same brain whether you're thinking about neurology or psychiatry. And so I just can't see the logic in sugar being helpful when we see that the opposite is actually helpful for a major physical disorder such as epilepsy. In terms of the direction that things need to go in psychiatry, I think that people need to be more mindful and just inquire with patients about their diet and their lifestyle choices, because my own experience is that most of the people I see in my NHS work are eating the wrong things and also making the wrong choices in terms of lifestyle. So often I'm in people's houses and they're inside all day, don't even open the curtains, or they're sitting in front of a blue screen or on their phone all day. And you have the issues with non-native EMFs in terms of mitochondrial dysfunction, but never mind the blue light toxicity that comes from all of the screens, and just complete circadian disruption by as a result of people not getting natural daylight. Never mind some exercise that can also be helpful for reducing oxidative stress in the brain and helping with our mitochondrial function. So I think we need to be better about asking and just being inquisitive about people's dietary choices. Having said that, unfortunately, most of my medical and nursing colleagues aren't eating the right things either, in my opinion. And so I think it needs to be complete re-education of all of the health disciplines. And whether that is possible, just given corporate influences, I don't know, is the honest answer.
I think, Ira, you just reminded me long back during I'm a pharma guy. So in one of our training sessions, we had a medical doctor who actually were telling that if anyone gets a headache, they just need to drink a glass of sugarcane juice.
Yes.
Oh gosh.
This is
Yes.
long back. It is a couple of decades back now. But since Ira told that, it is a flashback for me. I actually heard this from a doctor who was practicing, but he was also a pharma trainer. So, and I wanted to ask finally, like, one more question is, what is the role of fasting? How do you think, is it really effective? Can fasting be combined with diet and medication, or just medication and fasting? Does it have any role? Will it help?
I think for some people it can be a potentially useful add-on to changing their diet, whether they're on medication or not. However, I do tend to say to people with major mental illness, I do tend to caution them against doing any significant amount of fasting, just because the ketogenic diet is a fasting mimicking diet anyway. So they'll be getting benefits that would come were they to implement longer term fasts, such as 24 or even longer fasts. And I do sometimes worry about elevated cortisol and the stress of fasting for people who are in the middle of dealing with a major mental health crisis. But having said that, I think if people are able to adapt to a ketogenic diet and get very fat adapted over quite a number of months, then if they have some more stability in terms of their mental health, it can be a very potentially useful add-on to a ketogenic diet if they so choose to go down the route of fasting. Certainly from a physical health point of view, never mind anything else.
I recall Dr. Chris Palmer telling, I had interviewed him a couple of years back in a local podcast. So he told that in mental health disease, long back in Russia, they used to put patients on fasting. They will just lock them in a room, put them on water fasting, and then they will come out all healed. But then they will go back to the diet, whatever diet they have, and everything will bounce back. So this seems to be one of the very old reference. I'm sure you must have read about it, how in Russia they used fasting as a sort of therapy for mental illness.
Well, it's a quick way to get into ketosis, that's for sure. You just made me think there about the food that we serve people in hospitals and how horrendous even that is. And also the light environments are all wrong. So people are under artificial lighting 24/7 sometimes. And it's sad to see, but sometimes when somebody is in an acute admission ward, when it comes to psychiatry, they may not have access to get outside very frequently, depending on staffing levels. And I just think there's so much that we could do to improve things for people.
I think that was one of the questions I wanted to ask is, which you just told, that the blue light thing, the modern devices and all, I'm sure that they must be contributing to worsening.
Yes, because having too much blue light can actually raise your blood glucose as well. So There are just so many problems in relation to blue light toxicity, never mind disrupting circadian rhythms, and that then leading on to mitochondrial dysfunction as a result. But certainly if somebody's in a ward all day, sitting on their phone, there are issues with dopamine activation. There's just so many different angles that you could look at it from as being problematic. So
I think that is one more thing. We already have a high carbohydrate diet, the modern toxic food, the modern environment, probably heavy metal, and now we are adding up even the devices, and not to speak of stress and strain of modern life. So that is something which is already, and I think every one of us have faced some spectrum of mental health disorder, which is anxiety or disorder or depression. Probably is one of the very, very basic thing we have faced, and probably some people it just goes out of hand. Fine. Ira, you want to ask? Ira?
Yeah, just quick, I think, can you hear me?
Yeah, we can hear.
Yeah. So, Dr. Brown, just quickly as a last question, what would your advice be to people who are dealing with such conditions or mental disorders, and some specific key points that they can consider to improve their conditions?
Yeah, so my starting advice would be to make sure they're getting outdoor light. It's important not wearing glasses or contact lenses, because that can then block parts of the visible light and invisible light spectrum. That they try to get some sort of gentle activity every day if that's all that they're up to at the time, but also to think about making healthier choices in terms of their food choices. So eliminating the highly processed food with the inflammatory seed oils in them, focusing on whole foods, and trying to, over time, reduce their total carbohydrate intake, hopefully with some support and guidance from somebody who knows what they're talking about. And yeah, limiting toxicities always makes me smile, because sometimes the toxicity can be other people as well. So about managing stress, and there can be all different ways of doing that, but certainly being in contact with nature is something that's really vital. But I also think you'd mentioned about heavy metal toxicity, so sweating, and either through exercise or also having infrared sauna over time can be particularly beneficial if people have access to that.
Fine. So one final question I really miss asking you. You have an initiative called MedSci with Ali Houston. What exactly it is? Can you tell in 2 minutes? Do you provide services across the globe? What exactly is it?
Yes, so MedSci is a mental health coaching service. So we have monthly Q&A sessions with people. It's a low cost membership per month, and it's open access to you can be anywhere in the world as long as you can make the time of the meeting. And it's really just a place for people to get together, support one another in terms of using metabolic strategies to improve their mental health. But also a place for people to submit questions and have them answered by Ali or I, and also have other discussion within the group. So some group experience about troubleshooting if somebody has any issues along the way on their journey.
Fine. So you have an app also for that, correct?
Yes. So the app's been more Ali's doing, but yes, it's a really easy to use app where you can do some tracking of symptoms, but also track ketone levels if that's something that you want to do. And then hopefully over time, build up some insights into correlations in terms of what affects your ketone levels. And is there any correlation between your ketone level and your mood, for example, or other symptoms?
And it is very low cost, I believe.
Yes. So the app is free to download and use.
Thank you. Dr. Rachel, thank you very much for your insightful discussion. I think India does not have one single metabolic psychiatrist. And
gosh.
I told Nicole yesterday, I'm telling you now, I'm going to tell Dr. Georgie also when she comes. That is how the situation is. And it is so important that this message gets across, that people understand that there is a nutritional approach which possibly can provide relief. So thank you very much for your insights.
No, not at all. You're very welcome. Thank you for having me.
Thank
Thank
you.
you, Dr.
Namaste
Brown.
from
Thank you
India.
for coming over. Thank you.
Bye now. Bye.